All right, all right, all right. Hello, hello, hello. We are live. Oh my goodness. It is Sunday evening, and we are so ready to chat with you guys about all things having to do with moms and the potential new stresses that they're experiencing during this time. So today, we have Dr. Sriraman, and she is an expert in all things having to do with moms and moms having to do with lactation or any of those type of mom health items. She's an expert. So I'm super happy that she joined us today. And Dr. Sriraman, do you want to say hi and tell the audience a little bit about yourself?
Yep. Can you guys hear me? Uh-oh.
Yeah, I think
Can
you're
you
good.
guys hear me? I feel like I'm frozen.
No, you're moving and you're good.
Okay, good. Hey, thanks so much, Charmaine, for having me. I am so happy to be here, and I wanted to talk about some stuff that I've been seeing both in my practice as well as like in my social media account at Natasha Mom MD. Just to give everyone a background, I'm a pediatrician. I work in a children's hospital in Southern Virginia. I teach at the medical school, so I with medical students and residents every day. That's changed a little bit now with COVID. And then I see patients from the time they leave the hospital after they're born, all the way up through college. I'm also a lactation consultant. I specialize in postpartum mood and anxiety disorders, and I kind of, do all the other regular stuff that pediatricians do. But my passion is maternal child health and kind of the aspect of the postpartum period and what I like to call the fourth trimester. And a lot of that is because I myself am a mother of 3 children. They are older now, they are preteens and teens, but a lot of my passion comes from my own struggles in my postpartum period, whether it was breastfeeding or postpartum depression, and just kind of seeing the impact that has on a lot of my families that I see every day. So, especially with COVID, when Charmaine and I started talking, when we started talking about what I'd be speaking about today, and a lot of it is just understandably, I mean, the uncertainty of COVID, and we just don't know what's going to happen tomorrow, the next week, and things like that. And we're seeing a lot of that anxiety, understandably, in moms, and then how that's impacting their children. We're seeing this whether moms are breastfeeding, and we're also seeing this in moms who are going to be moms soon, because the whole aspect of delivery and what to expect when you go into the hospital to deliver your baby, that's all changed as well. So understandably, there's a lot of anxiety and, just uncertainty.
Oh my goodness, yes. So I mean, you touched on a few things, and I know that you have put out a little bit of information about some of these. And I know that there are new moms out there who are really, really, really concerned about the whole breastfeeding issue and what do they do, in that regard, in making sure that they are protecting themselves as well as their babies. Do you want to speak a little bit about that?
Sure. Yeah. So a lot of studies have been done, a lot of them obviously out of China. And I assume that we're going to be having, we're going to have a lot of data and things from here eventually. But what we're seeing is that the studies that were done looking at breast milk and things like that. Oh my goodness.
It's okay. It's live.
1 second. 1 second. Hey, everyone.
It's live.
I'm also
your dog wants to be part of the broadcast.
I'm also a dog mom. Sorry. So studies are showing that basically there is no COVID virus in breast milk, and it cannot be transmitted to the baby. So we definitely want moms to continue to breastfeed. Excuse me 1 second. Okay. We want moms to continue to breastfeed because that's obviously all the health benefits for mom and for baby. And I'm sorry, I'm a little distracted. So there's no transmission of the SARS-CoV-2, which is a novel coronavirus, in breast milk. So we want moms to continue to breastfeed as it is considered safe and things like that. The other issue that's coming up is that many of the hospitals, I don't know if you're seeing this in Michigan, Charmaine, but definitely in New York City and in the cities that are considered hotspots, a lot of moms are being expectant moms are being tested, as soon as they enter labor and delivery.
Mm-hmm.
So I think depending on the city, the hotspot cities, and obviously the hospital has to have a way to get that rapid turnover, those results. So the recommendation is that if a mom is COVID positive, how does that impact her starting to breastfeed in the hospital? And this has been met with a lot of, I don't want to say controversy, but people are upset, concerned about that, because if mom can't breastfeed in the hospital, how's that going to impact future breastfeeding? A couple things about that in terms of if a mom tests positive, but if she's not ill, what we're seeing, in our part of the state is that for a normal vaginal delivery without any complications, mom and baby are out within 24 to 26 hours. So for those moms, we want to see them the next day. So make sure you're seeing your pediatrician, because obviously whether you're breastfeeding or not, we have to check, their jaundice levels, their weight, and things like that, because, moms are being either, discharged because they want to limit the exposure. But a lot of times my moms actually are asking to leave early. I've had a couple moms who have had C-sections, and they're, leaving the hospital within 2 days. So that's very different than that's very different than when you and I had kids, Charmaine.
Right, exactly.
So the recommendation is from AAP, which is the pediatric organization, and ACOG, which is the organization for obstetrics, is that if a mom tests positive, like if she comes into the hospital and tests positive, that they're going to separate that mom and baby. And I know that's been very upsetting, and I've gotten a lot of questions about
upsetting.
that.
Oh my gosh.
Yeah, I've gotten a lot of questions about that in social media, as well as my own practice. I have nurses that are pregnant in my practice. And the recommendation is, again, like I said, there's no transmission of the virus within breast milk. So we want mom to breastfeed. And I think the recommendation is, they're trying to keep mom and baby safe, which of course that's what we want. But I think for mom to pump, the recommendation is for mom to pump, separate mom and baby, mom to pump, and to have an uninfected caregiver that give that milk, which is all fine and good. But we have to think about when mom comes home with baby. It's not right. That's not going to be sustainable or logical. It depends who's at home with mom. A lot of our moms, grandma can't come, aunt can't come. A lot of visitors are being limited. If there's a spouse or partner, what if they're essential or working, which I'm seeing in a lot of my families. So I just ask moms to be aware of this, because these are the recommendations. Of course, it's going to be different based on where you're at. Like in our part of Virginia, they are not testing every mom that comes into labor and delivery, but they are screening them. But the recommendation is to keep breastfeeding. If you're breastfeeding, then keep on breastfeeding. We don't want you to stop.
Awesome. Yeah, no, that's good stuff. And it's like logistics, right? Like there's a lot of things that are concerning, like you mentioned, and you even talked about having moms not skipping visits, right? So not skipping that first visit after the hospital, and then after that also not skipping any of the other subsequent visits, right? So like the 1 month and all of those follow-up visits where baby is getting immunizations. And for the people who have children who are older, who also need immunizations, they should definitely be seen as well. Is that about right? Because I know people are like, I don't know if I want to go in for the immunization, but it's kind of important.
Yeah, so that's thank you for talking about that. And I don't know if that was a question as well, but that's so important, because obviously, moms are wary of bringing their child in you're bringing them into a doctor's office. For me, specifically, my office is located in the hospital. So what do you hear on the news? COVID is all over the hospital. COVID is all over the hospital, but we're telling you to bring your baby to come see us. So my first piece of advice is that if anyone's nervous about it, call your pediatrician's office. We are used to getting these calls. Talk to your pediatrician or the nurse in the office, and find out what precautions they're taking. Most of the time, a parent, usually with the patient, with the child, we're going to let one parent in. We're not going to let the whole, mom, dad, grandma, grandpa, everyone. We're going to limit the number of people. You will be screened before you come in, getting your temperature taken, questions asked, and things like that. Most practices, what they're doing is they're separating newborns and well baby visits, like with the vaccinations, from the sick visits. For practices that have more than one site, this is ideal because they can make one site, site A for well visits and site B for, sick visits, for all of us.
Okay.
So for my practice and many practices, we're doing morning visits just for the newborns and well checks and vaccination visits. And the afternoon, we're doing sick visits. And what we're seeing is that we're not seeing a lot of sick kids.
Okay.
But, for those kids, because kids are still going to get colds, kids are still going to get ear infections. We're seeing a lot of rashes. I'd rather see them in my office than sending them to an emergency room or an urgent care.
Sure.
Plus or minus, there may be adults there. I mean, not everyone has a children's hospital. We do not
Yes.
want you to get behind on vaccinations. We do not, God forbid, want your child to get a vaccine preventable illness. Many
Yes.
people remember that just 6 months ago, we had a measles outbreak in
Yes.
California, in North
Oh my God.
Carolina, New York. So we really want to keep your kid up to date with vaccines. But it's also not just about the vaccines. It's, for those moms listening, when you bring your child in, I'm checking their weight, I'm checking their height, I'm talking about their development. I want to see if they're keeping track with their development. If your children are a little bit older and they're out of school, maybe the change in, obviously the schedule, kids who are in preschool or kindergarten or even like elementary school, there's going to be a lot of issues to discuss. And that's what that's a lot of the issues I'm discussing is kind of how to maintain some type of a schedule because everyone is kind of off schedule right now. There's really no school. Everyone is going to bed at all random times. They're not eating at certain times. So that's really been a lot of the questions that I've been fielding. But of course, the vaccinations are important, but we also need to monitor, growth and development.
Absolutely. Absolutely. Wow. Yeah, no, there's so much there because yeah, I mean that's the thing. So I appreciate you for sure reaching out to your patients and making sure that they have a means of getting answers to questions that they have because there is nothing more concerning to a parent than to not like know what you can do in a situation. So I know from personal experience that I truly, truly, truly appreciate our pediatrician and the fact that I was able to call him, on a Saturday or Sunday or whoever was on call for the practice and be like, hey, yeah,
Right.
can you tell me if this is okay? Like, should I keep the kid home or should I take him in? So we appreciate you. Thank you,
Right.
thank you, thank you. And it's great to know that practices are adapting during this time. So I know you mentioned that, you have a screening process. So you mentioned that, you can call in and then you can be advised as to where to go, whether coming into one particular practice that's funneling just the infants and then another site that's funneling the other children. And so that's awesome. People don't always know that. So it's good to kind of get that out there. The other
And
thing
there's
is,
also,
yeah,
oh,
go ahead.
sorry. And there's also, I think pediatrics is probably not on the cutting edge of telehealth because, we have to see the child and, I think examining, I think that was we're all a little weary of it. But, a lot of us, even our own practice, we're starting to do telehealth. So if it's something like, a rash that I don't need to listen to the child's breathing or anything like that, telehealth is always an option if you don't want to bring your kid in because of your concerns about exposure in the office or within a hospital setting. So a lot of practices are now have telehealth. Again, call your pediatrician to see which visits qualify for telehealth.
Right.
We don't really want to do well visits or obviously newborn visits by telehealth because we can't, weigh the child and, check heart and lungs and things like that. But for some sick visits, telehealth would be a really good option.
Oh, that's awesome. Yeah, no, totally. And then the other thing is, are you finding that parents are reaching out to you in this form? Are they calling the office more, or what are you finding in
I
your
think
practice?
a little bit of both. I mean, for my practice personally, like we are seeing a lot of newborns because babies are still being born, and
Right.
thankfully, I would say at least like 85 to 90% the parents are bringing in them for well child visits. For me personally, when I see a patient that I know and they haven't come and I know this is unlike them, I'll call them myself. And I feel like a call from a doctor or my nurse actually means more than maybe the front staff, because a lot of times they're asking those questions like, well, how do I know that, this is a good time, or my baby's going to be safe, or, and it turns into a little more of a conversation. So, and then we are getting a lot of calls through the triage line in terms of, what are COVID symptoms in kids, and, can I take vitamin C, and, things like that, things that, they're hearing on the news. Is that something that they can change at home, to decrease their chances of getting COVID. So yeah, they're getting more calls into the triage line about it.
Awesome. And then, we talked about, there's some issues that have come up in regard to child safety and child health that have been a little bit of unintended consequences of sheltering in place. For example, now there are potentially more disinfectants and cleaners maybe laying around because everybody's, being vigilant about cleaning everything. Have you seen, or have you noticed, or have you heard in the grapevine about that becoming a huge problem?
So we haven't seen too much, but I know our children's, the emergency room has, and I don't know if you have yourself, Charmaine, but obviously with the kids being home all day, and, if there's one parent or even two parents and you have, multiple children, it's hard, it's exhausting, to keep an eye on them all the time. And so you are going to see a little bit more injuries. You want to be safe. I think a lot of us are spending time outside, which is wonderful. But again, I have to remind my kids, you got to put your helmet on, whether you're skateboarding or rollerblading or biking, just to keep those safety precautions in place. I think everyone out there listening knows that what we've been hearing over the last few days, drinking disinfectant or injecting bleach or anything like that is a big no-no. That is completely not an option to cure COVID.
Right.
As a pediatrician myself, and as Dr. Gregory has seen as probably in the emergency room, is what we tell parents starting at 9 months of age or 1 year of age, you have to lock everything up. So if you're using those disinfectants more, to clean surfaces, clean doorknobs, please take it back and put it back in that locked cabinet or a higher cabinet. We talk about whether it's bleach or disinfectant or laundry detergent. I mean, we start talking about
the Tide Pods.
Or the Tide Pods, when the kid becomes more mobile and they start opening doors and things like that. So I personally have seen, ingestion of cleaning disinfectants and things like that. And, Dr. Gregory can attest to this too. It's, it's horrific. And it's going to cause, major problems with breathing. Your child will be in the hospital intubated. So please, please, please do not think that any of that information was correct. But of course, just be vigilant. Like if you are using more cleaning items, to put everything back.
Absolutely. Yeah, no, it's like it is constant. I mean, my children, thankfully, and yours as well, they're beyond the age where they'd be doing things like that. But when they were little, oh my gosh, it was constant, because we have one that literally was able to circumvent all the childproof locks. And so, you have the gangster child, the one that is just, I'm determined no matter what.
Or like that one plug you didn't put the cover on.
Right.
How they find that one outlet that wasn't covered, the one outlet of 25. There's always that one child.
And then I
swear
I'm a good mom.
I have the one child. He's 16 now. He would just catapult himself off the couch or, out of the crib. I mean, he was the guy who was just literally just, I don't know, he should have been in the circus.
Yeah. So, I mean, we get it, we get it.
Yeah.
But, do your best. Do your best. I know it's hard. These are increased stressful times in the sense that now you're in a scenario where you're maybe not used to your children being home all the time. And, you're used to this setup where, typically the weekend is when everybody kind of gathers together, decompresses, and, do things as a family. Whereas now you are adjusting to working at home, if that's where you are currently. And then also, helping to educate your children and then having them around 24/7. So totally get that there's increased stress. That is completely normal. Please don't think that you're a bad parent if you just want to lock yourself in the bathroom and like put on your noise canceling earphones. You're not a bad parent. That is normal.
Right.
Speaking from experience. So, you know, we should talk a little bit about those additional stressors that we're seeing in moms. So we mentioned the whole scenario of coming home from the hospital and, you know, being concerned about transmission through the breast milk. Can we talk a little bit about those moms who are maybe currently pregnant and are worried about the pregnancy and how things will go down
Yeah.
with this? Yeah.
Yeah. So I think one point that you brought up in terms of the stressors and feeling stressed out, whether you're pregnant or you have an infant at home, I think it's still giving yourself grace because we are all in a stressful situation. But I also, like, I've gotten so many DMs and messages about this that, like, well, I'm really feeling anxious and I'm worried about this going on after I deliver, but it's not that big of a deal because people are dying. And that's not the point. The point is that yes, COVID is serious, and unfortunately, we are seeing people die from COVID, but that doesn't minimize your feelings. So for my moms who maybe struggle with depression or anxiety during pregnancy or postpartum, please talk to someone, talk to a loved one. There's some great organizations like Postpartum Support International. I'm part of my state chapter in Postpartum Support Virginia. Like, all the support groups are virtual, so you don't even have to leave the house. I know it's hard because we don't have that physical connection with our friends, but
Yes.
whether it's talking to someone, FaceTiming a friend and things like that, so you have that social support. Again, maximizing sleep, which I know is probably going to be difficult because you probably, if you have like a 3-month-old, you were able to sleep when the 3-month-old slept, but now you have your 3 and your 5-year-old at home.
Right.
And you're unable to sleep. So you really need to talk to, whether it's your spouse or partner or a loved one to kind of help you with that, because that doesn't minimize the fact that, you're having these feelings and it's not just because it's COVID doesn't mean that it's not something to pay attention to.
Right.
And for the moms who are pregnant, it's so uncertain, and my heart goes out to each and every one of you. Like, I had I had my kids were via C-section, and I know in some hospitals they're not letting your spouse into the OR, which
Right.
is so difficult.
Yes.
But so, what I tell my moms who are bringing in their babies who are pregnant, I have some nurses that are pregnant, and I've spoken to my OB colleagues here that deliver when, and then I see the babies, is that they basically said, just, we just don't know. And, as you see in the emergency room and I see in the pediatric clinic, we are just inundated with policies and protocol changes. I mean,
Oh,
how
yes.
many
Constant.
how many emails a day are you getting? Like 1
A
to 2
lot.
emails in a day. And that's
Yes.
just from our hospital system. Then you get the emails from your state. Then you get your emails from your professional organization. So what I want to tell my moms is that, depending on when you're going to deliver, like, I mean, as opposed to, May 15th versus July 15th, a lot is going to change. But, if you're kind of in the next 2 to 3 week period, I would touch base with your obstetrician or the nurse and ask them what the hospital policy is. And I just try to tell my moms that this is no intention of any of us to separate you from your spouse or separate you
Right.
from your baby. This is to keep mom and baby safe, but also our staff. So a lot of
Right.
times, many of these hospitals, the reason they're limiting visitors or testing moms is because there's a few studies. There was some studies out of China, and now they're starting to do some studies here, is that 40% of pregnant women were asymptomatic. So that means that they were transmitting the virus without any symptoms. They weren't ill. So what was happening is that, if you think about the obstetrician and the nurse and the staff and the pediatrician and all the people who have that kind of extended amount of exposure that happens during a delivery or C-section, all those physicians, nurses, and staff are getting exposed. So you will see your obstetrician and the nurses kind of, in their whole gown, not the mask and everything like that, face shields, but it's also to protect the the physicians and nurses and the hospital workers. So right now it really depends. Usually they're letting, one person in for the delivery. That may change depending on the city, depending on the region. That may change if it turns in from a vaginal delivery to a C-section.
Oh yeah.
I know there's been a lot of questions about doulas. The doula organization in North America, dona.org, that may also be an issue because they are promoting that doulas should be in the delivery, but again, it's hospital policy. So
yes.
I know a friend of mine, saying that they're going to put the doula on FaceTime.
Okay. All right. Hey,
Yeah,
that works.
so the doula on
That's
FaceTime.
a way. That's a way to work around that.
Yeah, so I think just, kind of having as much information as you can, that is possible before you go in, is going to be the best thing that you can do. But like I said, it changes so quickly.
Yes.
And it's going to change depending on where you are in the country and, and your region and kind of what the statistics are in that state.
Absolutely. Absolutely. Yeah. So this is why it's a great idea to really just kind of stay on the pulse as far as your hospital is concerned. If you are a pregnant lady and you're looking at your birth plan, all that, be in close contact with your obstetrician and with the hospital so you can see what the changes are going to be. Because yes, it is definitely a dynamic process and things are changing pretty rapidly and essentially on a daily basis. So you just have to kind of stay abreast as to what the policies are so that you are not blindsided when you arrive at the hospital to deliver your cherub. So
Yes.
just keep that in mind. Definitely.
And then plan ahead, like if someone was going to come and, stay with you. That question has come up a lot. Like, if grandma was supposed to, baby's grandma was supposed to come or the mother-in-law was supposed to come, what am I supposed to do? Like I had one mom saying, her husband's military, so he was still essential. And she goes, what should I tell my mother? So, we're recommending, that person, whoever it is, needs to quarantine for at least 2 to 3 weeks, before they step into your house, because not only are they protecting you and the baby, but remember, if you're an asymptomatic carrier, you may be spreading that virus to someone who may be more susceptible to, severe disease, like a grandparent or someone who has comorbidities. So just to kind of plan ahead with that, if you have someone coming, to help out and things like that.
Absolutely. No, that's a good point because, that help in the very beginning is so important because that's extra stress, right? So you just gave birth and maybe you had a complicated delivery, maybe you didn't, but even if you didn't, there's still that stress of feeding baby, making sure you get a little bit of sleep in between and just, baby's vulnerable at this point, no immune system quite yet, et cetera, et cetera. So definitely having a good plan and figuring that all out ahead of time will be helpful because you want help if you can get it.
Oh, yeah.
Just so important for your mental health as well and your well-being. Yeah, because the postpartum blues is serious. It's real.
And we still want you to sleep. I mean, it may not be, and it may not be as easy if you have all the toddlers and school age kids home, but kind of look at your people live in the house and who can help. I have moms who have teenagers at home or preteens, and I'm like, it's okay, they can make their own lunch, and you need to sleep. When the baby sleeps, like you don't have to. It's okay for us to take time off. Like I need everyone to be rested and happy and healthy before you can take care of everyone else. And I think sometimes as moms, we obviously want to take care of everyone else, but you may have extra kids at home, your spouse or partner may be working from home, and that's okay. They can kind of, take over a feed or, take the other kids out, out for a bike ride. So you and the infant can, you and the newborn can sleep. It's okay. It's kind of just really finding your new normal for now.
Yes. Yes, indeed. Yep. I do remember those days. It's been a while. It's been like 8 years now, but I still remember having all of them under 4 years old.
Oh yeah.
What?
I know. I had 3, 5 and under. And it's just
that was fun.
I had 3, 5 and under, and it's like a blur. I had 2 in diapers, and like you did, and it just that's exhausting. That's really exhausting.
It is. You kind of don't remember it, which is kind of,
that's the point, right?
Maybe that's a protective mechanism. I don't know.
That's probably the point. So we keep having children.
You kind of don't want to read. That's right. That's right. Or else it probably would be like, no, I don't think so.
Did a question
Oh
pop
my
up from
gosh.
somebody? I thought I saw a question when we were chatting.
No, someone said that she wanted to take a listen, but she couldn't at the moment, but she
Okay.
was going to put it for an item to review tomorrow. So I told her,
Okay.
yay, thanks for stopping by.
Yay.
Yeah. Yeah. So I'm not seeing any questions. I'm just gonna check one more time just to make sure. But I guess the one other thing that we can maybe touch on is, you know, so we talked about how moms can deal with stress in the sense of making sure to stay connected, making sure that they're looking at the potential resources that are out there for mental health if they're feeling like they're in that situation. So referring to the postpartum blues in particular, because that is pretty can be pretty intense. And we often feel a little bit of guilt associated with that because we feel like, well, how come I'm feeling this way? Why am I feeling sad when I have this beautiful baby and I should be feeling happy and energetic, but I'm just not? So realizing that that is something that you can experience, and we can experience it to varying intensities. So it might be something as simple as a fleeting thought, and it can also be something that is all consuming, and you just get to the point where you get dissociated from your family, from your baby, and you fall into a deep depression. So recognizing the signs. I know we do a really great job of putting that information out at the prenatal visits. We do it at the time when you're in the hospital. We try our very best to have information about that, in the offices, like even at your guys' office. I know you guys probably have something along those lines, and you ask moms how they're doing. But are there any resources that you can think of offhand that they can reach for or reach out to if they're even feeling like they need to talk?
Yeah, so I think well, there's a lot of great apps that people can pay for to talk to a mental health therapist. I think the best option for any perinatal depression or anxiety is go check out the website Postpartum Support International. You'll have a huge map, and you just kind of click on where which state you live, and that'll kind of drop you into that state chapter. And I know for us in Virginia, we have the state split up into 5 regions. And if you click on, just say you click on my region, all the perinatal psychiatrists, all the therapists, all the support groups, everything pops up. So for us specifically, all our support groups, which are usually, they may be held in hospitals or churches or whatever, but because of social distancing, they're being held virtually. So that's a great option. I think even if you don't want to talk, be part of a virtual support group, I think reaching out to that support group leader, because that support group leader is usually a survivor of postpartum depression. So they may be able to, talk to you and guide you and be like, okay, you're in this area, here's a great therapist, or here's a perinatal psychiatrist, and things like that. But for the moms who are, who may have a history of it, whether it's during the pregnancy or during the previous child, if you know you're feeling this way, talk to your OB. Do not wait for your 6-week check. And if you have a history of this, or if you're on antidepressants or anti-anxiety meds, and for whatever reason you aren't on them anymore, or if you felt like you were doing great this pregnancy, talk to your obstetrician, because they can restart the medication. And then if you have a therapist, but reach out to them, because I know for us both in the adult world and in the pediatric world, all of our therapy appointments, all of our psychiatry visits, everything is telehealth. So it's literally like you can pop in your headphones like we're doing right now, get on your phone and kind of do your visit that way. You don't even have to leave the house. So I really recommend that as a resource.
Awesome. Yeah. So I flashed the wrong thing above. So now the right website is there. So it's postpartum.net, and it has all of the local resources. So awesome. I was just looking at it. It's a pretty cool site. I
Yeah,
did
it's a
not know
great
that
site.
existed. So I'm learning
Yeah,
something new too. It's
yeah.
awesome. Yeah, no, this is great. Um, yeah, so I mean, we talked about a lot of stuff today.
We did. I feel like for me, it's just the constant, like, because it's just I've been talking about this so much over the last few weeks, both like on my social media as well as the practice. So it's great
Yeah.
to kind of reiterate it. But like you said, we have to update ourselves because policies and protocols are changing and things like that. So kind of, I think anytime you have, whether it's a podcast or a blog about COVID, we always have to preface it with like, well, right now, this is what it is. And it could
Right.
change,
Right.
like right now, there's no transmission of, the virus in the breast milk. And, if a mom is positive, like if she tests positive, like, what you're seeing, we have colleagues, we have physician colleagues and nurses who are pregnant, and they may get COVID. I mean, healthcare professionals are getting COVID, and
Yes.
some of these healthcare workers are pregnant. So again, there is no the studies. Again, we're just getting them out of China right now. I think we're going to have a slew of studies coming out of the States once kind of all of this kind of starts to minimize after we figure out the acute issue. But studies show that there's no what we call vertical transmission. So just say I'm a nurse or a physician, I get COVID. Of course, the stress is there, but there's no known risk of COVID passing to your baby. And I think it's just like any infection, like if a mom had a bad flu or another type of infection, obviously that risk is just the same as if it was another type of infection.
Awesome. I'm writing this down so I can flash it across the screen.
So,
All right.
again,
Awesome.
yeah. And I think for those healthcare workers who are pregnant, I think, talking to your supervisor or your department about, getting redeployed. Like maybe I had a social worker reach out to me who was in the ICU, and, she was very worried. And I said, just talk to your supervisor. And basically what they did was that she was doing 3 days, via telehealth, like she would contact the patient by phone. And then the other 2 days she was, not directly in the ICU. She was in she was in an office setting. So
Okay.
I think most hospitals and employers will be amenable to that. Maybe, you're not in the ER or right in primary care or in the ICU. Maybe you can do something more, administrative until you deliver and things like that, or until you're, ready to go to the hospital.
Awesome. 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 Nice. 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 Oh my goodness. So, any final thoughts on this topic and on what you've been seeing? Because I know you've been seeing quite a bit from the parent side as well as from the children's side. So,
yeah, I just think that I just want to thank everyone, for both myself and for Dr. Gregory and for my husband who's in the ICU. I know it's really very difficult with the kids being out of school, and it's really hard not to have that play date or that sleepover. But from all of us, we really want to thank all of you, because when you socially distance or physically distance, I want to say, and kind of listen to the experts, which is us, the physicians, the public health researchers, and the scientists. You are keeping yourself safe, you're keeping your family safe, but you're keeping my husband, Dr. Gregory, all of our families safe, because we're the ones who are going to be taking care of these patients. So I know it's really hard, and it's a very challenging time, but
yes.
I just want to shout out to everyone, because that's so important for all of us, because what I like to say is an individual action has a community impact.
Absolutely. Absolutely. And it is very profound. When we all participate, it is quite profound indeed. So, yes, thank you. I echo that. We are definitely grateful for everything the communities have been doing. I'm sure that there's been an outpouring where you are. There has been a huge outpouring here in Michigan, and people have been just absolutely amazing. And I think as a result of that, excuse me, as a result of that, my children are right here, so this is why. As a result of that,
we all know what it means to be a mom.
I'm just saying, it's like, hey, it's happening.
We all get it.
It's live.
It's life. It's life.
Exactly. And we because you may think that you're not doing, something huge, but you are. By sheltering in place, you really are. By, when you go out, making sure that you have that distance between you and that other individual, it really makes a huge difference. And we appreciate you because, trust me, we want to take care of you, but we also don't want to see you come in and be in extremis, because that makes us very, very sad. And we want to make sure that you do well. So thank you for, doing the things to stay safe and stay healthy.
Thank you so much.
All right. Well, thanks for coming on. I really appreciate
Thanks for
you. This
having
has
me.
been awesome. Yeah, such a great conversation. And we may have to do this again at a later
Yep.
date.
And then if there's, I know if questions come up as people, you can find me on Facebook and Instagram, Natasha Mom MD. Drop me a question and I'll be happy to answer it.
Put that up there for you. All right, so you can reach Dr. Sriraman at Natasha Mom MD. Okay, guys. So definitely hit her up with questions, and definitely she has a lot of great information that she puts out regularly on her social media. So definitely hit her up for all of those things. All right, awesome.
And we'll do this again soon.
Yes, absolutely. All right, take care, you guys.
Thank you so much.
Have a great night.
Bye.